A new survey suggests vaccination skepticism is actually rising, leaving Canadians concerned about unnecessary illnesses.
The Angus Reid poll found 17% of parents are really against vaccinating their children. That's up from just 4% in 2019. Meanwhile, 55% of Canadians said they support mandatory childhood vaccination in schools. That's down from 70% pre-pandemic. And for more on this, we're joined by Dr. Dina Kulik. She is an assistant professor with the Department of Pediatrics at the University of Toronto and the founder of Kid Crew Medical. Dr. Kulik, thanks for being with us. As a doctor, an expert, how do you interpret these numbers?
They are concerning, to say the least. We have come a really long way since our parents' generation and our grandparents' generation in ensuring that we can decrease the risk of vaccine-preventable illnesses with vaccines around the world. In our grandparents' era, there was a lot more risky illnesses going around, like polio and measles and other illnesses that were close to or almost eradicated. Now, with less vaccine rates and vaccine hesitancy, as you're describing, the risk is that we will see more of these illnesses that can cause significant health risks and even death to children and adults around the world.
Okay, so Dr. Kulik, you just mentioned measles and polio. We literally thought that those were behind us. We're seeing those global outbreaks. So can you connect the dots for us between, the rise in those infectious diseases and the lack of vaccinations?
There's a direct relationship. We know that if enough people get vaccinated for these illnesses, we then have what's called herd immunity. If, let's say, 80% of the population gets vaccines for measles, polios, et cetera, the risk of getting those illnesses is quite low. As people are hesitant around vaccines and the rates of vaccines go down, when there's less than, 80% or more percentage of people getting vaccination for those things, that's when these vaccine-preventable illnesses start to rise.
Dr. Kulik, there is so much information out there. There's also so much misinformation out there. How do you talk to parents who are genuinely overwhelmed, unsure, scared, not sure what to make of all the information that's out there, and really not sure what's true and what's not?
I think it's really important to meet parents where they're at and find out what do they know or what do they think they know, where have they gotten that information, and what are their concerns? Why are they hesitant about giving vaccines? Are there specific vaccines they're hesitant about, or is it all vaccines? And really importantly, what do they think the risk is of these vaccines? Because we have decades worth of data on many of these vaccines about how they are safe and they're effective. Also, there's a lot of misinformation about the benignness of some of these illnesses. Like, oh, it's no big deal if my kid gets, this illness or that illness. And so educating could be helpful to show them, really, some kids do die from these illnesses or have very significant disability because of them. They are not necessarily benign illnesses that every kid will be completely okay with.
Okay, and Dr. Kulik, just bear with me here. There has been, the anti-vax movement amongst a lot of parents, and they're saying that, there's a link between, being vaccinated and the possibility of autism. How do you deal with that?
So that's been refuted for decades now. There was one single study many, many years ago that was falsified. The researcher, that study was pulled from publication. He lost his license. It was just not true. And unfortunately, that particular study remains in people's minds. There are tens of thousands of published research articles that show there's no link at all between any childhood vaccine that we give and the risk of developmental challenges such as autism. There is no link at all. It's very, very strongly refuted. There's no evidence that that is the case.
I think it's really important for parents to hear that, especially coming from an expert like you. A lot of parents might be thinking, I'm not going to get my child vaccinated. That's a personal decision. That doesn't have anything to do with anybody else. But can you help us understand the bigger picture here? What happens when parents decide not to get their kids vaccinated? How does that impact other children?
Well, if your child is not vaccinated, they are at risk of getting these vaccine-preventable illnesses. And as we were talking about before, if enough parents decide they don't want to vaccinate their kid, then there are going to be more of these illnesses coming up. That means more people getting measles and polio and tetanus and other really life-threatening illnesses. And that will require more hospitalizations, more emergency care, and it's very risky for not just kids that are immunocompromised, but all children. Any child can succumb to any of these illnesses. It's not just kids that are higher risk. But of course, we want to prevent illnesses in these populations as well. Some kids can't get vaccinations, for example, kids that have undergone chemotherapy or other therapies like this. So we, of course, want to prevent illness in these populations, but it's also for every other child in Canada is at risk, and not only certain kids are at risk.
Okay, Dr. Dina Kulik, assistant professor with the Department of Pediatrics at the University of Toronto and the founder of Kid Crew Medical. We thank you very much for your time this afternoon, Dr. Kulik.